Hello, my name is Jasmine, and this is my PhotoVoice documentary. It is about school-based sealant programs for low-income communities. This PhotoVoice project highlights how dental sealant programs improve access to preventative care for children in underserved communities and to reduce oral health disparities. The problem and population needs. Dental caries continue to be a major health concern, disproportionately affecting children from low income and underserved communities. Although dental sealants are proven cost effective preventative measure that can significantly reduce the risk of caries, many children do not receive them due to barriers such as limited access to dental services, lack of awareness, socioeconomic disparities. This Photo Voice project seeks to explore these challenges visually and narratively, emphasizing the need for expanded access to school-based and community sealant programs to improve oral health outcomes. The priority is population for this program is elementary school children from low-income communities. These children often attend schools like these. This is school in Weld County, Billy Martinez. This is here in my hometown. This is actually where I went to school for elementary. This school is in a low-income community. I grew up in a low-income community, so I didn't grow up going to the dentist a lot or just getting any dental care. The primary need for this population is to access preventative oral health care, specifically dental sealants that protect against caries. According to the CDC, children from low-income households are less likely to receive sealants and are twice as likely to have untreated caries compared to those from higher income families. So most of the children here lacked regular dental care. Many low-income schools in rural areas and inner cities across the USA show higher rates of untreated dental decay and lower participation in preventative programs. So within this group, there's children from minority backgrounds, particularly Hispanic and African American children experiencing higher rates of dental decay and lower rates of dental application. According to the CDC, children in rural areas also face increased disparities due to fewer available dental providers are available in these areas. There's limited access, the cost, lack of awareness. So we're going to move to barriers to care. There's plenty of barriers to care in a low-income community. First one, transportation. Transportation can be hard. For some families don't own a car. Another big thing is work. A lot of these families have to work very long hours, have to work every day of the week. So it's very hard for them to get them to the dentist. It's hard for them to ask for a day off to get them to the dentist. Some of these parents have to choose between groceries and a dental visit. A lot of these parents want their child to see a dentist, but they really can't take a day off of work. Another thing is costs. Maybe some of these low-income communities have Medicaid, but again, when they have these barriers of having to take off work, they're really not getting to the dentist. And if you don't have insurance, cost is a huge issue. So usually 6-year and 12-year molars are the ones that sealants are being placed on. So this is what we want to kind of implement. So data shows that only about 48% of children aged from 6 to 11 years have dental sealants, and the rates are much lower for low-income children, according to the CDC. The lack of sustainable funding and infrastructure for school-based programs has limited access in the long-term success. But the target really is first and second molars on children's age from 6 to 12 years old. Sealants are proven cost-effective preventative measure that reduce pit and fissure caries in children. So here we have an example of a sealant, kind of getting all these little pits and fissures, and that this will be a huge help for these children. So the sealant program in action. So to be able to kind of afford dental services, we have these school-based sealant programs that provide free preventative care directly where children spend most of their day, removing major access barriers to this. So this is a huge help that will help primarily age children 6 to to 12 years old. We would prioritize low-income, Medicaid-eligible children. These groups, since these groups have lower salient prevalence and a higher treated caries. Then we would go to like Hispanic children, Black children, African American children in these communities. So sealants protect molars from cavities and reduce long-term dental problems. So this is what that would make a community impact. Preventative oral care strengthens the entire community by promoting healthier futures and reducing healthcare costs. These needs exist due to barriers such as the lack of dental insurance, transportation, limited awareness, like we talked about. So this would be a huge change. So then what we really need to change is increase funding for school salient programs, more dental clinics. Education is huge for these parents, so getting the education to these parents and making sure they know the impact to the children. I mean, they would reduce caries. I mean, they wouldn't just be getting to the doctor when there's pain, because this would be done as a preventative measure. So truly a child feels better when they're not in pain. So this is these children with happy smiles after receiving sealants. Children experience less pain and improve focus and have a better school attendance because they don't have to miss because their teeth are not in pain. Every child deserves a healthy smile regardless of income or zip code. Some states have implemented school-based sealant programs, which these programs are not universally available. Or adequately funded. Efforts like the CDC's Seal America initiative promote evidence-based strategies to expand access, but coverage stays inconsistent in some communities. This project shows that when care meets community where they are, real change can happen. It's hard to truly understand a low-income family if you're not in their shoes. I grew up in a low-income community. I grew up on food stamps and Medicaid, and I did not receive a lot of dental care. My parents were too busy working, and really is truly not educated on oral health, so they didn't see it as a big deal. We know children need to be at school, and meeting them halfway at school and providing this preventative care is a huge step forward. School-based dental sealant programs increase sealant coverage and reduce caries among elementary school children. So this would be a huge change. I know it's already happening, and just kind of expanding on this and getting to more places in the United States will be huge change. So these are my references. Thank you.